Hello everyone. Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Kalman Novin. I'm working with Dr. Muhammad Gulame Bilalam from Dhaka University, Dhaka, Bangladesh. I'm presenting our work about cardiotogram biomedical signal classification and, and interpretation for fetal health evaluation. This is the outline of the presentation. For experimentation, just if you just double your devices right now to patching the one fetal before you even complete or maternal, they are going to feed you with all this terrible information, bad news about the fetal distress, things to do with the fetal positioning, fetal heart rates, leading to maternal mortality, maternal morbidity, and lots of other challenges. Generally, this is a big problem, and it's mainly caused by the delay and different other kinds of problems. You may think, well, that's a problem, but this is the thing. Muhammad Ali said that everyone really has a plan until they are punched right in the face. You may all want to have children someday, but things are going to change when someone gives birth to a child like this. This is a human being. This one here is also a human being. This one you see here is also a baby, and this one is also a baby of someone. This is also a human being. Now, all these ones you see here are human beings. And you know, they are all looking for a chance to live. They want to live normal lives. But due to different fetal complications, their faces are deformed and they are facing these different kind of challenges. And some of them even fail to study. All these things happened as a result of various fetal complications. Now, the many causes of fetal complications are not only the inaccess to maternal and child health care, but also this COVID-19 has really made things really worse because mothers are really fearing to go to the health centers. They are running away from the health centers. Not only that, but even those who leave to run out to go back to their homes are extremely financially constrained. Check a mother like this. You know, if someone really stays in this kind of environment, how do you really expect them to really give birth? You know, maybe they have failed to access the health center accordingly, but also they are financially constrained to actually afford this kind of services. You know, the medical insurance says that not everyone can be able to afford the medical insurance, but the healthcare costs are quite high. Therefore, the financial aspect, then the COVID-19, and also various other things are leading to a few of these things called future complications, but that's not actually the big problem. Here's where things get more interesting. That even when a mother gets a chance to visit a medical personnel, these are the kinds of results that the medical personnel is going to see. And when they see, they keep on asking themselves, what do the results mean? You know, they get so much confused, most especially the new interns or the new recruits. And yet these are the people who are mainly available to support the mothers. They don't have the decades of experience, but they are willing to serve. But the existing technologies are extremely limiting, yielding a lot of giving data, but the data is extremely ambiguous. Therefore, and not only that, but even the doctors themselves who are experienced enough, they still find it hard to interpret these kind of results. Now, these are cardiotocograms, usually obtained after measuring the fetal heart rates. It's one of the best technologies that exists in order to prevent fetal health complications, but the interpretability of these kind of results is really a big problem in healthcare. Generally, we can say that the ambiguity, the ambiguous reactive approaches to maternal and fetal healthcare are really the leading causes of maternal, are really one of the biggest contributors to maternal mortality and maternal morbidity. And then they cause a lot of delays because if someone's confused about a given thing, don't expect them to make a decision instantly. They are going to have to cause delay, which delays really the ambiguity, which ambiguity leads to delays, and these delays here often are going to they're often going to lead to maternal mortality and maternal morbidity. The doctors are always asking themselves, which treatment plan can we choose? Which direction? Where should we go? That kind of medical uncertainty in the healthcare decisions is really a big problem. And to make matters worse, it usually pops up as a result of reactive, you know, someone just reacting to the instance that they've just seen. So reactive medicine is bad, but also the ambiguity of the results that happened after the assessment makes things even way much more worse. You know, the existing works are all focused on reactive maternal fetal medicine. And a few uncertainty trials for those who have money for the various medical treatment plans. Then extremely expensive maternal fetal monitoring technologies. And some of them are not even feasible when it comes to resuscitatics. For example, in Africa, where people are so much poor that they cannot even afford to have power. Though some of the the maternal fetal monitoring tools are not going to be able to work properly. Now we can say that machine learning has been done. Yes, it has been done somehow, somewhere, but this is where things get interesting. The adoption of this technology is quite low, simply because people cannot trust the black box predictive models. They don't know how the machine learning and AI came up with these good classical results that are very good at predictive in nature. So even if the AI has been done, since it's black box, its adoption is quite low, which still leaves this question unanswered. Generally, all existing works are focused on reactive maternal and fetal medicine, and mainly to do with the patient survival during the application of the treatments. We have not found any transparent, trustable approach to predictive, preventive, and precision medicine for maternal and child health. And that's why we thought of taking advantage of what we have. If we know that we have a lot of data, and for example, the existing cardiotocogram biomedical data for electronic fetal monitoring, that can be made use of. Then if we could simply apply a few computer science and data engineering techniques, then we could be able to at least build explainable, trustable machine learning and artificial intelligence models for predictive, preventive, and personalized medicine. Mainly for this case, we are just going to be focusing on the biomedical signal classification, mainly for the fetal evaluation. And for this, what we did is that we're able to obtain an open data set from the UCI machine learning repository, and it had over 23 attributes and over 2,126 instances. And for this one here, we first tried to look at our target classes. And yeah, they were a little imbalanced, but we're going to be able to handle that. But also try to put a correlation heat map to see how these features relate to one another. So we got to discover that amongst all the variables, the blue, wherever you see the blue green, where you see the blue green fields, that's what represents no correlation at all. But wherever you see relative intensity in area blue and blue colors, like here and here, that means that there is actually there's an increase in correlation amongst those particular features. And whenever you see relatively an area blue, that reveals a negative correlation or an indirect negative correlation amongst those particular features in our data set. Now, for the data imbalances, what we had to do is that we had to resample. We had to resample the data completely, because we cannot build machine learning algorithms based on unbalanced data, because it's going to be biased some extent, and the variance is also going to be so huge. Therefore, we have to first resample the data before training the machine learning models, to prevent the high skewness of the signal classes of the cardiotocograms in one way or the other. Then we simply had to first separate the signal target classes, like the way you can able to see them here. Then we sampled the majority classes, which was one. This one here was the majority class. We had to resample it. Then we randomly produced results which were combined with the majority classes after the sampling. We then extracted about 23 dimensions of separate target classes and variables that were then scaled and extracted in one way or the other in order to build a standardization of the data set that we could be able to potentially use to train the machine learning models effectively. And we got some good results, like this. You can see the 90% for the gradient boosting classifier, 99 for cat boost, the LightGBM, decision tree, and then the voting ensemble, because just to build some voting ensemble to combine all these ones here. And the results are generally good, but this is the problem. You cannot, even when you convince the doctor that these results are good and you have predictively made a judgment of what could happen, these results, when you present something of this sort to the doctor, it's just going to be confusing. In fact, the doctor is just going to get frustrated that you're presenting technologies that you're claiming to be good, but it's not, the doctor is just not understanding it. So here we thought of what if we could actually deploy explainable AI techniques in one way or the other, because it is very possible to actually predict the right results using the wrong metrics, and it's also very possible to actually predict the right results for the wrong reasons, and that is a very big problem. Therefore, we all agree that it's not, when it comes to healthcare and machine learning, it's not all about the accuracy. It's about how the algorithms actually come up with the results. That's why we were able to deploy explainable AI. This is a summary of just the existing explainable AI techniques But for us women, what we followed is that we generally followed the model agonistic one, and then we simply deployed explainacam 5 or ELI5, and this is it. Explainacam 5 simply assesses the weights and the weights of each feature and its contribution to the predictor. So we can say that if we say that the probability of someone having a fetal complication is 1, then or being classified as 1, then we are going to be able to understand the weights. The doctor is going to be able to see the weight of each of the individual features that are contributing to this kind of classical result or this kind of decision. Now, if a doctor can be able to look at this one here is something that's way much more better as compared to something of this sort. Therefore, if you can able to look at these numbers by looking at the weights of each of the individual features for each particular feature, at least that could be able to help at least the doctor can be able to trust what you're trying to build for them. Generally, we wanted to solve this particular problem or the fetal health complications by revolutionizing the technologies that are being used by simply applying machine learning. But we don't only stop at the machine learning alone. We demystify the ambiguity by simply applying explainacam 5 to put a smile on the doctor's face by giving them interpretable results that they can be able to base on, at least to draw a clear judgment or treatment plan for their patients. Which means that if a doctor can be able to look at this and understand the features that are most contributing to this kind of problem, the doctor can then be able to at least be able to draw a better treatment in one way or the other. Maybe they could think of assessing or interviewing the patient for maybe some other symptoms that they initially ignored. Generally, we can say that the doctor can be able to at least proactively take action in one way or the other. Then what we did here, we built machine learning models. Then we demystified their ambiguity by using explainable AI, and now we produced explainable results in one way or the other for the doctors to put a smile on their faces, so they can be able to swiftly adopt the technologies that we have built for them. So at least they can be able to ensure predictive, preventive, and personalized medicine for each and every patient. And then that's what we did. In the future, we hope to build an accessible, standardized, explainable biomedical evaluation management framework, at least to support the researchers and innovators in developing new medical advancements and treatment procedures for maternal fetal medicine. But we also really strongly encourage that people who are trying to build AI for healthcare, they try to explore by really try to demystify the technologies that they are building using different explainable AI techniques to ensure precision medicine. I thank you so much for listening to me. We believe that with explainable AI, we are able to secure a future for mothers and children. Thank you so much for listening to me. Assalamu alaikum wa rahmatullahi wa barakatuh.